From Rectangle Health, this is the Modern Practice Podcast, a show that provides you with fresh perspectives and practical advice from industry experts in the ever-changing world of healthcare technology. Every episode, we tackle a timely topic to help you stay current and simplify the business side of healthcare. Without further ado.
Hello, everybody, and welcome back to the Modern Practice Podcast. We've got a very special episode for you all today. We're joined by Rectangle Health's Executive Vice President of Marketing, Michelle Dowling, to talk about an incredible initiative called Rectangle Health Cares. Michelle, so happy to have you back on the podcast.
Hey, Gary, it's great to be here, and I'm excited to talk about Rectangle Health Cares today.
Awesome. Well, let's get into it. Michelle, when you hear about this program, as you walk through the halls of headquarters in New York, on Zoom calls, and in company get-togethers, there's this instant heartwarming feeling you get. It means so much to team members, and it came to life under your guidance and vision. Can you tell our listeners what Rectangle Health Cares means and stands for?
Absolutely, Gary. Rectangle Health Cares has truly been something I'm so grateful to have been a part of. It came together and really drove our company's vision and mission. And just like everyone's individual personality, each company has their own set of core values that makes them unique. So without sounding cliche, providing a way for our team to connect with and feel confident in a set of values that are both authentic to us and describe who we are, it was essential. The first step we took when we kicked off the initiative was to poll our employees to hear directly from them. And we found that several values kept coming up: growth, stability, teamwork, client satisfaction. So there were a few iterations of the value statements, but what we centered around were things that were consistent throughout the organization, things we heard over and over again, which were how we hold healthcare providers and practitioners in the highest regard, how we pursue goals and seek continuous improvement to serve them, that we focus on new creative ways to approach and solve problems, that we take initiative and action to make decisions, and we work together in partnership, both internally and externally, to create great outcomes.
Michelle, those values are evident in the forward-facing messaging and content being shared by your team and the organization. Did you interview clients as well?
We did. We polled our clients to find out what they thought of us. And predominantly, we heard things like, we make it easy, and being easy to implement made us unique. Good customer service, being exclusive to healthcare, offering secure products topped the list. Our clients made statements like, we replace manual processes with automation, that our system is flexible and easy to integrate. We increase patient payment capture. We offer superior relationships and service. And we wanted to make sure their thoughts were reflected in our values. From there, we also focused on what we wanted to consider what makes an exceptional workplace and what attributes we wanted to highlight for our teammates. Things that were important to the executive team and senior leadership were characteristics such as holding ourselves accountable, being adaptable, having empathy and humility, being smart and solution-focused, good stewards of the corporate brand and our services that we provide, and being tenacious. And we believe that success is truly driven through each of these, corporately, departmentally, and of course, individually. So when we reviewed all the inputs together, we came up with Rectangle Health Cares, which was a great acronym. And what that means is that we champion client success. Clients always come first. We act with integrity and purpose. We respect the healthcare community. We excel at everything that we do, and we shape what's possible.
The meaning and purpose behind Cares is so impactful. I want to ask, why was it so important to you and to Rectangle Health as an organization to launch a program like this?
It's a great question, Gary. And for me, there were three things that we were looking to accomplish. We wanted to offer connection, inclusion, and inspiration. It is so important that our teams and our clients feel connected to one another and to our overall organization. And sharing the same values accomplishes this. Being included creates a sense of pride, and it helps us to navigate change and difficult times, but it also serves as a North Star to excellent performance and what our expectations are. We aren't in it just for ourselves. We want to be included in something special, and we want to serve the healthcare industry to make it easier on them to provide care for others, and that empowers us to do our best work. This leads us to be inspired, to come to work each day, to give it our all, to do the best job we can, and have fun along the way.
That's incredible, Michelle. Thank you. And I want to say it speaks volumes about you and the rest of the leadership team to put Rectangle Health Cares in place and continuously build momentum around it. I want to take us back to the inaugural Rectangle Health Day when CARES was officially launched. Staff members headquartered in Valhalla, New York, and in the Las Vegas, Nevada offices came together for a special initiative. Can you tell us about it?
Absolutely, this was a special initiative. I love this day. And just like the core values that help us center and feel connected, included, and inspired, this day was something that we all wanted to feel that we contribute. Participating in this day, doing work for a special cause, allowed us to be part of making a difference, get out of our own head, and do something together. We selected a charity called Heart to Heart International. And this charity seeks to improve healthcare access, not only in the United States, but around the world. And they believe that ensuring quality care is provided equitably in under-resourced communities and for disaster situations. We work with them to create hygiene kits that were sent globally to those in need. We created over 10,000 kits in our Valhalla and Las Vegas offices. And Heart to Heart International did such a great job with the logistics. They were fun, they promoted an atmosphere of joy, and our teams worked together so well. I love seeing them come together across departments and share time and experience together. We heard so many stories about how much they love the event and they can't wait to do it again. And with so many people being remote, my challenge is to find ways for them to be included in another event like this as well.
That's amazing, Michelle. And for our listeners, if you'd like to see a highlight reel of the inaugural Rectangle Health Day activities working with Heart to Heart International, there'll be a link in the description below. Michelle, I want to move forward to ask, when a company starts a program like this, you're really looking for sustained effort, continued support, and I think that's evident here, especially with a notable campaign within the Rectangle Health Cares initiative, Hometown Healthcare Heroes. It's all over Rectangle Health social media, and people are talking about it. Can you tell our audience what this campaign is and how they can even be a part of it?
Absolutely. Our initiative, Hometown Healthcare Heroes, was a way for us to shift the narrative and shift the focus onto what good is being done in the world and our communities. There are so many positive, contributory, beautiful stories of people going above and beyond in their everyday lives. And we wanted to create an awareness of that. So instead of hearing negative posts or seeing negative news, our idea was to light up social media with happy stories that make people smile and feel good and recognize those who are truly serving people, everyday people like ourselves. And the response was overwhelming and very moving. I love reading these stories. We had our teammates nominate healthcare heroes who are special to them. We had people nominate clients and friends, personal practitioners, really anyone who is in the healthcare industry, and we opened it up to all of our clients. We made it easy by just putting together a simple submission form, and anyone can nominate a healthcare hero. We don't limit it to clients, we don't limit it to anybody, as many submissions as you want. The idea here is to just recognize people for the good that they are doing and bring it to light. There are healthcare workers around the country doing incredible selfless work, and I could not be happier to acknowledge them and showcase their contributions.
Yeah, Michelle, for anybody scrolling through the Rectangle Health social media channels, it's easy to come by any one of these hometown healthcare heroes and truly be moved by their stories, by them just going above and beyond to serve their communities outside of the call for care. Before we get to the last question for our listeners tuning in today, if you'd like to nominate a hometown healthcare hero of your own, the link to the form Michelle just mentioned is in this podcast episode description. Once you submit, be sure to follow Rectangle Health across all of our social channels to see your hero featured. Michelle, just to wrap up, how, in your eyes, Rectangle Health has evolved as an organization since you came aboard?
It's a great question. I think one of the things that makes our company the most special is that the mission has actually been consistent for almost 30 years. And it's captured in the last letter of CARES, S for shaping what's possible. Over these last 29 years, we've worked consistently to get providers paid so that they can thrive, so that they can focus on taking care of patients. We've created a culture of innovation and continuous improvement. We're comfortable being uncomfortable because what we do is we look at what's happening in the non-healthcare world and create the same opportunities for our healthcare practitioners. And we have made a vision so clear by doing all of the work we just discussed, which is that healthy practices make healthy patients. And we believe that it's our job through our mission to simplify the business side of healthcare that we actually help that vision come to life so that practices can be healthy operationally, administratively, and financially. So we know that making things that are hard, in creating simplicity, by that way we confront complexity, we sweat the details, but we create these user-friendly experiences. And we strive to make a difference in the lives of those in the healthcare community, believing that we're part of it, which is much bigger than just technology. And we want to continue that. And we want to keep evolving to make significant contributions and connections to our partners, to our providers, and to employees.
Really amazing, Michelle. Thank you so much. It's been a pleasure watching and following the Rectangle Health Cares initiative come to life, evolve, and continue to grow this past year. And just really looking forward to seeing what's next at Rectangle Health. Thank you again for joining us.
Thank you, Gary. Thanks for asking about how this came to be. And these initiatives that happen behind the scenes are so meaningful to everyone that we encounter. So this was awesome. And thank you for giving us this opportunity to talk about it.
Of course, looking forward to talking again soon. Before we go, just a reminder, everyone, we've got a few links in the description below. Check out details on the Rectangle Health Cares initiative. Plus, you can nominate one or more hometown healthcare hero of your own. Thanks for tuning in. Till next time, everybody.
Thank you for listening to the Modern Practice Podcast. If you enjoyed today's conversation, subscribe on Apple Podcasts, Google Play, Spotify, or SoundCloud for new episodes. And follow Rectangle Health on social media for more helpful information, news, and event details. Thanks for tuning in.